Shadow Minister of Health Dr. Cummings, during her budget presentation on Wednesday, contrasted the healthcare system under the coalition government and the current state of affairs. She noted that the number of hospital beds is a key indicator of the strength in healthcare delivery services. According to her, the number of hospital beds has declined from 42 beds per 10,000 people between 2000 and 2002 to just 36 beds today.
Hence, after spending nearly $400 billion Guyana dollars on the health sector, this government could not bring this country to a better place than it was 30 years ago. This is clearly not a government for the future.
Minister of Health Dr. Frank Anthony fired back, stating that the coalition party added 0 hospital beds. He boasted that in a few months the government will be opening 6 new hospitals, each with 75 beds. In contrast to the APNU AFC's track record, he highlighted that over the past 3 years, the government has built 25 new health posts across Guyana and trained more than 500 community health workers.
Finish there. We have the Ogle facility, 252 beds. You have New Amsterdam, 240 beds. You have West Demerara, 220 beds. And then all the hospitals, Maruka, another 50 bed. Latem, another 50 bed. Keto, another 50 bed.
Cummings, while addressing human resources, criticized the administration for allowing a significant portion of healthcare professionals to leave the system. She stressed that the coalition government was working to build a reliable healthcare system, unlike the current administration, which, she claimed, failed to pay nurses higher wages.
The spiteful and reckless conduct of this government, with its refusal to pay nurses a decent wage and to honor them for their sacrifice and commitment to this country, has now left every citizen depending on fewer nurses for care, and the remaining nurses seeking second jobs.
The health minister countered by stating that the People's Progressive Party increased nurses' salaries and that, at present, over 3,000 individuals are set to graduate as nurses and nursing assistants. Additionally, another 3,000 will be registered for these programs this year.
That we have a track record to stand on.
That's correct.
You don't have anything to stand on.
That's correct.
And that is why we can confidently go back to the electorate, because they are proud of what we have delivered and they will re-elect us again.
Dr. Cummings also criticized the government for failing to provide high-quality, safe and effective drugs and medical supplies. She pointed out that $28.1 billion was allocated for drugs and medical supply, with billions paid up front. Yet, $1 billion worth of drugs and supplies remained undelivered.
The Honorable Minister must immediately implement an electronic logistic management information system, the ELMIS, to track the stock, the usage of the drugs and in the losses. No more expired drugs, no more empty shelves, no more excuses.
In response, Dr. Anthony presented several Auditor General reports highlighting various scandals in the health sector under the APNU AFC government. He stated that between 2015 and 2020, drugs and other supplies were constantly out of stock. One of the reports he noted revealed that only 43% of supplies reach health centers and hospitals.
Come with the facts, because under this government, the supplies of pharmaceuticals is at 90% across the system. Compare with your 43 and dismal record.
Tiana Cole reporting for the HGP Nightly News.